Very good morning to all of you. So today's tutorial is on Sims speculum. So Sims speculum, so we have different types of speculums. So first of all, just let's have a look at all the speculums. So this is a Sims speculum, and this is another part of the other say, instrument which you have to use with this instrument. So Sims posterior vaginal wall retractor and anterior vaginal wall retractor, and you have this is a self-retaining bivalve speculum called as Cusco's self-retaining speculum. So these are not self-retaining. Somebody will have to hold, hold it for you. And these are once you put, there is a arrangement of screw over here. So you put it inside the vagina, open it like this, and then you can tighten this screw, and then the instrument will stay there like that, and you can carry on your procedure through this end, right? So let's first see Sims speculum. So this is a typical Sims speculum. J. Marion Sims was a surgeon who was posted by British people at African in some African country. So what he used to get, the number of patients which he used to get, they all belonged to, fistula patients. So they were all having either vesicovaginal fistula or rectovaginal fistula. Because of those days, they used to give a lot of trial to patients, and patients used to have obstructed labor. And then they used to have fistula. So most of them were urinary fistulas, vesicovaginal fistula, because the head used to get stuck in obstructed labor, and the bony head used to compress the bladder and vagina, the bladder and vagina in between the pubic symphysis, anteriorly one bony part and posteriorly head, right? So this all used to cause necrosis of the in-between tissue of maternal tissue, and that used to lead to vesicovaginal tissue. So this instrument was basically devised by J. Marion Sims. That's why it's called Sims speculum. So initially he didn't use this. Initially what he used to use was Sims speculum was nothing but a household tablespoon. So he just bent a tablespoon and used to put it in the vagina and use another spoon and then see and look and diagnose for vesicovaginal fistula. Then slowly, with the when the technology advanced, then slowly he devised this instrument. So this instrument is either L-shaped or you can say J-shaped when it is single bladed. When you have two blades, it becomes C-shaped. So either C-shaped when it is double-ended, it is either L-shaped or J-shaped, you can say, when it is only having single blade, right? Now look at these two blades, right? One blade is little smaller than the other one, right? There are certain Sims speculums where this is significantly smaller than the other side. This is to fit into different types of patients and different lengths of vagina when you're doing speculum examination, right? So this is a steel made, it is made up of steel, and it can be sterilized by autoclave. So there are certain points you must always remember whenever you are describing any instrument. One of the important point is you must identify the instrument, then describe its typical characteristics. Then you have to describe about the sterilization procedure, how you are going to sterilize the instrument. So instruments like steel instruments, they can be sterilized by autoclaving. If you are in a hurry, you have say 200 patients in your OPD, and you have say 10 speculums or 20 speculums. You'll have to reuse it. So you wash it with soap and water, and then it is put in a boiler, right? And you boil it for 10-15 minutes and remove it and again use it after cooling it, right? So sterilization otherwise is done by autoclaving in the OT, right? And if you are still in hurry, then there is a 20 minutes procedure that is called as after you wash it, you can put it in a solution called Sidex. It is nothing but 2% glutaraldehyde, right? So when you want to do quickly, it can be put in Sidex. But Sidex is a little expensive solution. So we always use autoclave it, or we we sterilize it by boiling, right? Now look at this instrument carefully. It has a centrally, there is a concavity, right? There is a trough, right? So this trough is basically to drain the vaginal discharge, or if you are using it in labor room or in OT, it will drain the collected fluid. Most probably, it is either amniotic fluid in labor room or it is blood if you are using it after third stage. Or if you are using it in OT, it could be menstrual blood, it could be DNC while you do DNC, that blood, or it could be postpartum hemorrhage when you are examining the patient, right? So this instrument is basically used for examination of the cervix and vagina, the apical vagina, right? So how do you use it? You are going to put it in the posterior vaginal wall, right? So if this is the vulval aperture like this, if this is the vulval aperture, you are going to first put it vertical and then retract the posterior vaginal wall like this. So if vulva is like this, right, you are going to first put it longitudinally, it will go inside and then you are going to retract the posterior vaginal wall, right? So this is how the posterior vaginal wall will be retracted. Now what about the anterior vaginal wall? Because the vagina is H-shaped, the anterior vaginal wall is sagging like this, right? So to retract that, you will have to use now this instrument. This is a anterior vaginal wall retractor. So like this. So this is retracted by posterior vaginal wall, and anterior vaginal wall will be retracted by this instrument. Got it? So these instruments are used together, right? So this instrument was meant when it was devised to retract the posterior vaginal wall and to see the cervix internally, because the anterior vaginal wall will be sagging like this. So to retract that upwards, you will need another instrument. This is anterior vaginal wall retractor. So they are always used together. So Sims posterior vaginal wall retractor and Sims anterior vaginal wall retractor. Now let's have a look at this instrument. So it is a instrument having two ends, right? Both the ends are fenestrated and they are having serrations on it, right? So these serrations are made so that they can fit into the rugosity of vagina, so it will not slip, right? So you are going to retract the posterior vaginal wall and you are going to retract the anterior vaginal wall. Then only you will be able to see the cervix and you will be able to do procedures on cervix. You will be able to hold the cervix. Otherwise, cervix is, cervix is, if cervix is like this, it is the anterior vaginal wall sags like this. The posterior vaginal wall is, like in this shape. So it is H-shaped cavity. So that the cervix is not exposed to outside uh, introitus and infection is prevented through internal genital organs. So you have to retract both the walls, right? So these instruments are used together. Now, as I said, once if you want to do any procedure on cervix, one hand will be holding this instrument, another hand will be holding this instrument, right? But then what happens? Your both hands are occupied now. So you require an assistant if you want to do some procedure on the cervix. So I'll call my assistant. The assistant will hold both these instruments, and then I will be doing any procedure like taking pap smear or doing DNC, or I want to take a endometrial biopsy. So any procedure like hysteroscopy, then I'll require some person to hold this. Now to overcome this problem, there is another instrument called as cusposed bivalve self-retaining vaginal wall retractor or vaginal speculum. So as you can see, it is like a bird's beak of the bird, isn't it? So it has an anterior blade and posterior blade, right? And it is a hollow instrument. And then there is a handle, and this handle has a locking system. So this locking system is nothing but once you open it, right? So you're going to open it. Just imagine my mouth is like the cervix. You have put this speculum, and now you can see the cervix. So just imagine my lips are cervical lips, right? So now you're going to see from here the cervical lips, right? And then what happens? You are going to, once it is opened like this, right? You are going to tighten this screw, this screw. Once it is tightened, it remains open, right? So once it is tightened, it remains open like this. So now I don't require any assistant if I have to do certain procedure on the cervix, right? So it is called as self-retaining custos bivalve two valves bivalve, self-retaining vaginal wall retractor. Now, what are the advantages of this instrument, or what is, if a question is asked, which instrument you would like to use, or compare and contrast between two speculums, or in which situations you would like to use which speculum, then you would say that if you have an assistant with you, and then it is always better to use this instrument because it gives you a better vision, right? Because the instrument blades are not coming in your way, at least on lateral sides and anteriorly. So vagina can also be inspected except for the posterior vaginal wall. Otherwise, vagina can be examined or visualized well with this instrument along with cervix. Once you use this instrument, then anterior vaginal wall, posterior vaginal wall are obliterated. You can't see them. You will just see the cervix. So both vaginal walls cannot be seen when you are using this. Only the cervix can be seen. The advantage of this instrument is it is self-retaining. You don't require an assistant, right? So if you have any procedure which needs to be done only on cervix, only on uterus, and you are not interested, or you don't want to examine the vagina as such, or there is no vaginitis, then you can use this instrument, right? But otherwise, this instrument you will be able to assess the vaginal mucosa also, right? So this is the difference between these two instruments. Now just imagine when patient has postpartum hemorrhage and you are suspecting trauma, you want to visualize the posterior vaginal wall. You can use same instrument in an opposite direction like this. It will retract the anterior vaginal wall, right? You can use both same posterior vaginal wall retractors to retract both anterior vaginal wall and posterior vaginal wall inside OT, because these are big instruments. They will cause little pain to the patient. So it's always better you explore the patient in such situations in under anesthesia, right? The smaller sizes of these instruments are used. These are big. See, this is a very big size, right? Can you see? Yeah. So such instruments, smaller instruments are used in OPD, and such bigger instruments are used under anesthesia, maybe during different procedures on the cervix, or even for vaginal hysterectomy. You are going to use this. So you will appreciate that this blade in this instrument, this blade is smaller than this blade, right? So if vagina is capacious, if this is not giving you clear view, you are going to change the blade, right? And whatever blood, whatever is discharge, whatever collection, it will drain out through this truck, and it comes in and falls in the either the dustbin which you are using, or you can collect it in the kidney tray for sample collection. Now, where will you use these instruments? All these speculums are used. See, they can be kept in obstetric table viva, or it can be kept in gynec table viva. So, if it is taken together, it's a different thing, this viva. But if they are separate tables, preferably a good student should answer depending upon which table you are sitting. Like if the viva is on obstetric table, then you will say that since speculum will be used for diagnosing premature rupture of hemorrhage, whether the Riker is coming out. You will put it when there is postpartum hemorrhage, when the patient has antepartum hemorrhage, to know whether the bleeding is coming from inside the cervix or it is coming from outside the cervix, like that. Right? If you are on a gynec table, then you will say that it is basically done for OPD, in OPD for examination of vagina and cervix. Right from vaginitis, routine pap smear, cervicitis, if there is collection of discharge, the discharge can be taken and sent for examination, right? To diagnose different types of vaginitis, to take pap smear, to put IUCD, right? And in OT, you are going to use it for different surgical procedures like dilatation of cervix and curettage of endometrium, commonly called as Jnmc. Then you can use it for uh, hysteroscopy. You can use it before suction evacuation in the case of MTP or iridiform mole, or it can be used for exploration of a patient who is bleeding, maybe a rape victim, or maybe a patient who has come with certain bleeding in this thing, right? So these are the indications of using SIM speculum and cuspo speculum. So please have a look again. This is a SIM speculum, C-shaped, or when only one blade is there, J-shaped. or L shape. We have C-shaped speculum where both the blades can be used, right? Both sided blades can be used. This is an anterior vaginal wall, same speculum having ends which are fenestrated. One is smaller than the other, right? So they are pairs of this blade, right? The smaller goes with smaller, the larger goes with larger. There are rugosities or there are serrations on these fenestrations. These are supposed to fit onto the rugosities of vagina so that it has a good grip on anterior vaginal wall. This is for this you require an assistant. Somebody will have to hold it, but it gives a visualization of both vaginal walls little better than the uh, cuscose speculum. Cuscose speculum is a bi double bladed, no? Double bladed or bivalve, and it is self-retaining because once you open it, you can lock it and it can visualize the cervix from like this, right? And then you're going to take either pap smear, you're going to do all the procedures on the cervix. So these speculums are used for routine gynec checkup, routine obstetric checkup in labor room, in OT, in your OPD every day. So this speculum is the easiest. This instrument is the easiest instrument which you can pick up if an examiner gives you choice, right? So sim speculum. So one, two, and this is the third one. So these three instruments you all should be very comfortable in describing. Always describe uh, about the sterilization method. They can be asked. They can ask you that. So these are metallic instruments. They are always sterilized by either autoclaving or by boiling. There is a 2% glutaraldehyde solution which can be also used. In that solution, you have to clean the instrument and dip it in that solution for 20 minutes. But it is little expensive than these more economic ways of sterilizing the instruments. So questions will be asked to you about identifying the instrument, the marks are for that. Then the marks are on uses, indications and uses. Then the marks will be on different, the Viva might go on different procedures like pap smear. If you say, they might ask you questions on pap smear. They might ask you questions on different types of vaginitis. So I always say that, instrument stable Viva is to assess your practical knowledge. And it shows whether you have attended OPD, you have seen labor room patients or not, you've gone to OT or not. So basically they assess your knowledge of all the procedures, all the what we actually use in practice. So it is just a means to start Viva on your particular. And a good student always leads her own Viva, right? If I give you sim speculum and you want your Viva to go on pap smear, say pap smear first. You don't have to say very uncommon condition and your Viva might just shift to that topic, right? So sim speculum and cuscose Viva we have done today. Just remember the father of gynecologic surgery, J. Marion Sims. He had invented this instrument. He was experimenting a lot on these African women who you were having psychovaginal fistulas, and back those days there were no suture materials. So what he used to do, he used to suture them with silver wire. Those fistulas were repaired by silver wire. Many of them must be failing also. So this is how these instruments were a moderated version of a normal tablespoon, which was devised by J. Marion Sims. So the name goes by his thing. So there are many surgeries on his name also in gynecology. So this is Sims speculum, Sims posterior vaginal wall retractor, which can be used to retract even anterior vaginal wall in certain situations. Sims anterior vaginal wall retractor, and then this is a cuscose speculum. So what can you use if this instrument is not there? If anterior vaginal wall is not, retractor is not there. This is a common question which is asked. Then you can use a sponge holder. A closed sponge holder can be used to retract the anterior vaginal wall. Or you can use a smaller sim speculum to retract the anterior vaginal wall. Right? So I think I'm very clear about the sim speculum. And if any queries you have, we can always discuss in the WhatsApp. Thank you so much.